The urinary system is made up of the kidneys, ureters, bladder, and urethra. The kidneys are two organs, left and right, in which urine is produced. Once formed, urine passes from the kidneys to the bladder through the ureters, which are two tubes 20 to 30 centimeters long, each leading from one of the kidneys. For its part, the bladder is a hollow balloon-shaped organ. When it's full, it contracts and urine is expelled from the body through a tube called the urethra. To watch the Spanish version of this video, you can find the link in the description box. Well, stones can form in the kidneys, which in medical terms are known as kidney stones or nephrolithiasis. One or more stones can form at the same time, and this can be as small as grains of sand or as large as chickpeas, and they can remain in the kidney or be expelled in the urine to any part of the urinary tract. It's estimated that up to 50% of the general population develops kidney stones. They are more frequent in individuals between 40 and 50 years of age and predominate in men in a ratio of 2 to 1. Different factors are involved in the formation of kidney stones that are related to a disorder in the absorption, metabolism, or excretion of the components of the stones, or with alterations in the pH of the urine, that is, the acidity or alkalinity of it. Cases of nephrolithiasis secondary to predisposing diseases such as cystinuria, hyperparathyroidism, renal tubular acidosis, laxative abuse, etc. are rare. Kidney stones are solid bodies composed of inorganic crystals and anorganic matrix. Once crystal formation has begun, it's retained in the urinary tract and growth occurs throughout the aggregation of new crystals. Based on their chemical composition, urinary stones are divided into 4 main groups, namely calcium stones. It's estimated that approximately 75% of all cases of urinary calculi are calcium oxalate. Struvite stones, magnesium ammonium phosphate stones, better known as struvite calculi, make up about 15% of kidney stones and are formed from recurrent urinary tract infections. Uric acid stones. These represent about 5% of the total lithiasis. They can form in patients with gout, in people who lose too much fluid due to chronic diarrhea or malabsorption, and in patients undergoing chemotherapy, among others. And cystine stones, which affect 1 to 2% of all stone patients. They form in people with an inherited disorder called cystinuria. The symptoms due to the formation of stones in the urinary tract depend a lot on the size and the location, and they range from asymptomatic pictures to others that can pose a serious danger to the patient's life. However, the symptoms that occur most frequently are renal colic, hematuria, and urinary tract infections. Usually, a kidney stone doesn't cause symptoms until it begins to move through the kidney or passes into the ureter. If a stone travels from the kidney to the ureter and suddenly obstructs the passage of urine, the kidney swells, the ureter spasms, and severe pain occurs called renal colic. This begins as intense pain in the lower back, which descends down one side to the groin and even the genitals, and is characterized by not calming down in any position and is usually accompanied by an increase in heart rate, elevation of blood pressure, sweating cold, and vomit. Said picture can be associated with the presence of hematuria, urinary burning, increased urinary frequency, and on occasions, intestinal symptoms such as diarrhea or a continuous but ineffective desire to defecate. Hematuria is the presence of blood in the urine and is due to the lesions produced by stones as it passes through the urinary tract. Finally, urinary tract infections can give rise to kidney stones or be a consequence of them. Non-contrast computed tomography is considered the gold standard for urinary stone imaging and can reveal even tiny stones. Ultrasound is another imaging test option to diagnose kidney stones. On the other hand, Plain abdominal radiographs are used less frequently because they can miss small urinary stones or those of uric acid. The natural treatment, both preventive and curative, is very simple and includes general measures and home remedies. The general measures are very simple to carry out and consist of the following. Drink 1.5 to 2 liters of water during the day in order to increase the dilution of salts in the urine. Drink a glass of orange juice daily, which is rich in potassium citrate, a salt that helps to dilute calcium oxalate in uric acid salts in the urine. Eat a low-salt diet. And finally, walking daily for at least 15 minutes, which contributes to the expulsion of recently formed small urinary stones. As for natural remedies, this, in addition to preventing the formation of stones by hydrating the body, also have a diuretic effect, which allows the elimination of most urinary stones. Here they go. Corn hair tea. To prepare this formula, you need a handful of corn hairs equivalent to about 40 grams and a liter of water. Put the water in a container, place it on the stove, and when it starts to boil, add the corn hairs. The preparation is left to boil for 5 to 10 minutes. Then it's allowed to cool. Pass through a strainer and that's it. It's recommended to take little by little in the course of the day. Horsetail tea. Horsetail refers to several species of plants in the genus Equisetum. For its preparation in tea, you need 40 grams of dried horsetail and a liter of water. Boil the water and add the plant. Let it boil for 5 to 10 minutes. Set to rest, strain, and that's it. It should be taken in small sips throughout the day. And Jamaica flower tea. To prepare it requires 2 tablespoons of dried hibiscus flowers and a liter of water. Its method of preparation consists of boiling the water, and once it has boiled, add the hibiscus flower and let it rest for 10 minutes. Properly covered, then it's passed through a strainer, and that's all. It's recommended to drink little by little throughout the day. You can choose only one of these remedies or even alternate them. In general, these preparations are taken for 10 to 15 days. Depending on the symptoms, then rest for 1 to 2 weeks and restart in those cases in which the patient still has discomfort, is undergoing chemotherapy or radiotherapy treatment, or has a catheter or medical device in the urinary tract, and there's discomfort from cystitis, that is, discomfort in the bladder. In 80% of cases, stones are eliminated in the first 3 or 4 weeks, depending on their size and location. However, any stone not expelled in 1 to 2 months usually requires medical surgical treatment. Currently, most stones can be removed by minimally invasive procedures, including endoscopic stone removal using ureteroscopy and extracorporeal shock wave lithotripsy, which involves breaking stones into small fragments that can be expelled more easily. Studies indicate that up to 60% of patients who have had a stone have the possibility of developing another in a period of less than 10 years, so the natural measures described above are highly recommended. In the long term, an untreated kidney stone can lead to loss of kidney function, centrogranulomatous, pyelonephritis, and rarely cancer, all of which can be avoided.